Yes, and bonjour à toutes et à tous. Nationally and in most health regions, COVID-19 disease activity is at low levels. Total active cases and average daily cases are about 95% lower than the peak of the third wave, with less than 500 new cases being reported daily. As well, with overall lower infection rates and increasing vaccination coverage, severe illness numbers are much reduced. Compared to the peak of the third wave, there has been more than 80% reduction in the average daily number of people with COVID-19 being treated in our hospitals each day, and over 70% fewer people in intensive care units, with an average of 13 deaths being reported daily. To date, over 40 million doses of COVID-19 vaccines have been given in Canada, which equates to over 26 million or 78% of people aged 12 years or older in Canada with at least one dose. Second dose coverage has been catching up quickly, with 44% of people 12 years or older fully vaccinated in Canada. This is great progress, and the benefits are mounting, with fewer and smaller outbreaks, reduced community spread, and significant reductions in disease severity. Moreover, recent evidence shows that all COVID-19 vaccines in use in Canada provide substantial protection against symptomatic illness and severe outcomes caused by variants of concern, with excellent protection after the second dose. It has taken a lot of effort to get where we are today, but we should not assume we have crossed the finish line. Canada is within reach of having at least 80% of the eligible population fully vaccinated, but we must keep the momentum up. While Canadians are steadily coming forward for second doses, the rate of increase for first doses has slowed. Dr. Kieran Moore recently issued a call for arms in Ontario, and I would like to extend that to all of Canada. Getting vaccinated benefits you and those around you, your family, friends, co-workers, and classmates. The best target to reach for to get ahead of highly transmissible variants as we head for an indoors fall is getting the highest possible vaccine coverage as quickly as possible. By rolling up your sleeve and lending an arm, you are doing the best to protect yourself as well as contributing to all Canadians getting better protected and getting Canada vax to the max. Thank you. Merci.
Bonjour à toutes et à tous. À l'échelle nationale et dans la plupart des régions sanitaires, la transmission de la COVID-19 est faible. Le nombre total de cas actifs et le nombre moyen de cas quotidiens sont d'environ 95% inférieurs au sommet de la troisième vague et moins de 500 nouveaux cas sont signalés chaque jour. De plus, puisque les taux d'infection sont globalement plus faibles et que la couverture vaccinale est croissante, le nombre de cas graves est beaucoup plus faible. Comparativement au sommet de la troisième vague, il y a eu une réduction de plus de 80% de nombre quotidien moyen de personnes atteintes de la COVID-19 qui sont traitées dans nos hôpitaux chaque jour et une réduction de plus de 70% des personnes dans les unités de soins intensifs. En moyenne, 13 décès ont été signalés chaque jour. À ce jour, plus de 40 millions de doses de vaccins contre la COVID-19 ont été administrées au Canada, ce qui équivaut à plus de 26 millions ou 78% des personnes âgées de 12 ans et plus au Canada ayant reçu au moins une dose. La couverture vaccinale de la seconde dose s'est accrue rapidement. 44% des personnes de 12 ans et plus ont été entièrement vaccinées au Canada. C'est un grand progrès et nous bénéficions de plus en plus davantage avec des éclosions de moins en moins nombreuses et de moindre envergure, une propagation communautaire réduite et une réduction importante de la gravité de la maladie. De plus, selon les données récentes, tous les vaccins contre la COVID-19 administrés au Canada offrent une protection importante contre la maladie symptomatique et les problèmes graves causés par des variants préoccupants et une excellente protection après la seconde dose. Il a fallu beaucoup d'efforts pour en arriver là où nous en sommes aujourd'hui. Mais il ne faut pas présumer que nous avons enrayé la pandémie. Le Canada est sur le point d'avoir au moins 80% de sa population admissible entièrement vaccinée, mais nous devons continuer sur notre lancée. Bien que les Canadiens continuent de se faire vacciner avec la seconde dose, le taux de vaccination avec la première dose a baissé. Le Dr. Kieran Moore a récemment demandé aux Ontariens de retrousser leurs manches et nous aimerions adresser cette même demande à l'ensemble du Canada. La vaccination est bénéfique pour vous et votre entourage, votre famille, vos amis, vos collègues et vos camarades de classe. La meilleure cible à atteindre pour dévancer les variants très contagieux alors que l'automne approche et que nous resterons à l'intérieur et d'obtenir la couverture vaccinale le plus étendue possible, le plus rapidement possible. En retroussant votre manche, vous faites ce qu'il faut pour vous protéger et vous contribuez à ce que tous les Canadiens soient mieux protégés et à ce que le Canada atteigne le plus grand nombre de personnes vaccinées possible. Merci. Thank you. Miigwech.
To date, we have brought in close to 55 million doses of COVID-19 vaccines and have delivered over 50 million of those across Canada. This week, as forecasted, we received 897,000 Pfizer-BioNTech doses. Deliveries to the provinces were completed yesterday. We also received 1.3 million doses of Moderna that are currently being distributed, and we expect a shipment of just over 1.5 million doses of Moderna tomorrow. With large shipments forecasted throughout July, the National Operations Centre has implemented an inventory management approach to ensure that Canada is positioned to appropriately steward the vaccines needed now and going forward. We intend to bring in 100% of the vaccines needed to fully immunize eligible Canadians, allowing provincial allocations to be held in central inventory for use by the provinces at the time and place of their choosing. We will also manage a strategic vaccine supply at the federal level in order to address emerging demands from the provinces in the months ahead. This will ensure we have sufficient stock at hand to counter surges of infections due to variants of concern and to address newly eligible populations. We are currently holding over 2.7 million doses in central inventory on behalf of the provinces and 255,000 doses in Federal Reserve. These numbers are constantly evolving. We are still tracking allocations of Pfizer-BioNTech in July, totaling 9.1 million doses, and we continue to work with Moderna to confirm upcoming delivery schedules for the balance of July's allocation. July is a pivotal month for Canada's vaccine campaign. We will continue to work across teams and with our partners to ensure that Canada has the COVID-19 doses required to maximize vaccination rates across the country. En date d'aujourd'hui, nous avons apporté environ 55 millions de doses et nous avons livré plus de 50 millions à travers le Canada. Cette semaine, comme prévu, nous avons reçu 897 000 doses de Pfizer-BioNTech. Les livraisons aux provinces se sont terminées hier. Nous distribuons présentement 1,3 million de doses de Moderna et nous anticipons une livraison d'environ 1,5 million de doses demain. Comme on prévoit d'importantes livraisons tout au long du mois de juillet, le Centre national des opérations a mis en place un système de gestion d'inventaire pour que le Canada soit en mesure de gérer les vaccins nécessaires maintenant et à l'avenir. Nous comptons obtenir la quantité de vaccins nécessaires pour immuniser complètement tous les Canadiens et Canadiennes admissibles. Les doses destinées aux provinces seront conservées dans un dépôt central, ce qui permettra aux provinces de les utiliser à l'endroit et au moment qui leur conviennent. Nous allons gérer également un approvisionnement stratégique en vaccins à l'échelle fédérale pour pouvoir répondre à des demandes potentielles des provinces dans les mois à venir. Cela garantira que nous ayons suffisamment de stock à portée de main pour contrer les poussées d'infection dues à des variants préoccupants et pour répondre aux besoins des populations nouvellement admissibles. Nous détenons actuellement plus de 2,7 millions de doses dans un dépôt central au nom des provinces et environ 250 000 doses dans la réserve fédérale. Ces quantités sont appelées à changer. Nous projetons toujours les livraisons de Pfizer-BioNTech pour le mois de juillet, qui totalise 9,1 millions de doses, et nous continuons de collaborer avec Moderna afin de conformer le calendrier des livraisons des doses restants pour juillet. Juillet est un mois charnière pour la campagne canadienne de vaccination contre la COVID-19. Nous continuerons de travailler avec nos équipes et nos partenaires pour nous assurer que le Canada dispose des doses nécessaires pour maximiser les taux de vaccination à travers le pays. Merci.
Miigwech. We will now open the phone line to questions. We ask that you limit yourself to one question and only one follow-up. We will be taking your questions in both official languages. Nous vous demandons de vous limiter à une question et seulement une question suivie. Vous pouvez poser vos questions dans l'une ou l'autre des langues officielles. We will start with the first question. Première question, opérateur.
Thank you. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. The first question is from Stephanie Levitz from the Toronto Star. Please go ahead.
Good morning. Thank you for taking our questions. My question is for Dr. Tam. I'm wondering, or I'd like to hear your thoughts on the discrepancy that seems to exist when it comes to how we're treating fully vaccinated travelers versus fully vaccinated Canadians in the context of quarantine and isolation requirements. Why are fully vaccinated Canadians still required to isolate if they have a high-risk contact with someone who's positive for COVID, but travelers are just allowed to be tested and skip quarantine, basically on the same assumption that they're coming into the country potentially having a contact with COVID?
Yes, so the current border stance is, as you said, fully vaccinated travelers who have the right of entry at the moment. So they don't, not necessarily Canadians, but there are some exempted groups of people. And so if they are fully vaccinated, there is a reduction in some of the border measures, including the full quarantine. We do, of course, advise people to keep up some of the personal protective measures and reduce spread to others potentially until the tests come back, but they don't have to quarantine. So I believe your question pertains to some of the domestic policies. And right. Now, of course, if you're a direct contact with a person who has COVID, it's a bit different than someone who's just traveled from a different country. But at the same time, I do know, based on my discussions with my provincial counterparts, that they are beginning to change some of those policies. And that if you're fully vaccinated, then you may be considered a contact, but not a high-risk contact. And the policies are shifting, I think, as we speak right now. But it may also depend on what setting you're in. So if you're in a healthcare setting, there may well be more stringent measures compared to, a community setting, for example, because you're dealing with a higher risk population. And so there's more precautionary approaches. But in general, I do believe that people are going to be reducing those measures for fully vaccinated people inside Canada.
And then I guess as a follow-up to that, I mean, as we know, children under the age of 12 still cannot be vaccinated. And so that leaves a lot of people in challenging situations. Think of a daycare environment, for example, where there is no masking that's possible. The teachers at this point may in fact be fully vaccinated, but they're forced into isolation if one of their charges comes down with COVID. How are we going to address that going forward, knowing that kids in particular, under 12, I mean, it's probably later this year that they'll start getting vaccinated?
Yeah, so the under 12 population is a very specific population that, and again, we are having some focused discussions with the provinces in terms of the guidance going forwards, because they can't be vaccinated at this point. And then what do you do with them? Because if you look at Yukon, for example, that's a good example of a highly vaccinated population, but an outbreak began in the younger populations, which then spread to other populations within those communities, including the younger kids, daycares, etc. So there is a risk of outbreaks in the non-vaccinated and under-vaccinated populations. So that is a reality going forwards. So one does have to still have some plans in place in terms of reducing risk in those settings in which children will congregate. And so fall school plans for the under 12 and other settings, day camps and overnight camps, those kind of guidance are being provided, really is to use existing public health measures to reduce some of those risks. It is a difficult space at the moment, but I think the objective is to keep children engaged in social and school settings for as much as possible. So I do think looking at ventilation, looking at all the other measures which have been working in terms of safety plans is key. But the other thing that really keeps schools open is a low community transmission rate. So by everyone else getting vaccinated and trying to reduce the amount of community transmission, that will keep kids being able to continue to do some of the things that are important to them.
Thank you, merci. The next question is from Mia Rabson from the Canadian Press. Please go ahead.
Yeah, good morning, Dr. Tam. I'm wondering if you could talk to us a little bit about what in Canada we know about the new Lambda variant of interest, if we are testing for it here or screening for it here, if we have found it in Canada, but also when the website is going to be updated so we'll know how many Delta cases we've seen. I noticed the website is still not listing Delta, so we don't know how many current cases there are or known cases of Delta there have been.
I believe you're on mute, Dr. Tam.
Apologize for that. Sorry. Yes, thank you for the question. And we are monitoring a whole slew of variants globally and also domestically, and they can be separated in variants of concern, variants of interest, and other things that just on the radar. That otherwise haven't really got to either of those classifications. So variants of concerns are the ones that we are more, getting national reporting, but we're also now, scoping in our genetic genome sequencing data from all across Canada, where we can also detect variants of interest. But obviously those take a sort of watch and gather information kind of approach. The Delta variant is the one that we have been keeping track of quite closely. And I do think that as we move forwards, we're discussing with the provinces, are we still just counting every case? Or really what we're talking about is counting general activity levels and the proportion of cases that are due to Delta. So that's why some of those discussions are ongoing. What is the most useful way of tracking them? But just for information to date, we have had, I think now, 4,654 publicly reported Delta variants, but they are different in different parts of the country. And some parts of the country have more of the variants of concern, being proportionately higher for the Delta variant, including parts of Ontario. So those are being tracked across the country. The variants of interest, there are quite a few of those as well. And you've probably heard of some of them. Lambda is one, the C37. So it is really a matter of just gathering further information right now. At the national level, we know of 11, but there could be further ones in the provinces that are just being gathered at this moment. And we don't know the full impact of the Lambda variant. That's why it's still a variant of interest, but it has really appeared in South American countries, in Peru and Chile and other areas. I think there are geographic differences, I believe, and there may be different hypotheses, but some areas are already dominated by the Alpha variant, and the Delta variant is now coming in and maybe replacing the Alpha variant because of some gains in transmission advantages. And I think things might shift for the South American countries if Alpha had been the dominant variant. But Lambda happens to have appeared and became one of the variants that is more dominant in their situation. I don't really know how Lambda will play out in a population that already is occupied, for example, by the Delta variant. And, there's a race between them. But it's important to now work out whether Lambda variant has any impact on our vaccines. I know that I believe there's a sort of preprint that suggests that current vaccines are still going to offer some protection, some protection against the Lambda variant, but that is a variable that we have to look at. But all to say is that given the low number of cases now, the majority of the of those cases will have genetic screening and genetic sequencing being done. So we're just trying to gather up some information on who it is that's having the Lambda variant right now. But there's very few cases at this point.
Thank you. And you mentioned in your opening that you're a little concerned about the slowdown in first doses. And it appears that younger people, not teenagers necessarily or youth, but the 20-year-old group and even the 30-year-old group have really slowed down and are not even above that 70% marker yet. How concerned are you, given that we know that that's one of the groups where the COVID-19 virus seems to spread the most quickly? And how concerned are you that maybe they're not getting vaccinated as much, and what is being done to try and encourage and improve those vaccination rates in that population?
Yeah, that is a challenge and a gap that has been noted across the country. And in terms of even the first dose, in particular for that young adult age group, and they are a group that has more social mixing and also connected to the other higher risk populations as well, who, even with 80% vaccine coverage, are not necessarily entirely protected. And so it is very important to try and get as much vaccines into arms, as it were, for that group. And so I think, Yukon, again, I'm going back to that territory as a example of what could happen as people reopen social economic spaces, is that, and it was social events, for example, that occurred that then led to impacts on other groups that then led to some hospitalizations, ICU admissions, and a small number of deaths as well. So that could happen anywhere where there's low vaccine coverage. And so then what can we do about it? I think at the federal level, we're trying to incentivize systems and fund community level ideas, and so that's partly what the federal government can do, and in our communication channels, engaging influencers, social media, leveraging employers, because many of this group have connection with employers and getting the business and other communities to encourage vaccination. You've seen some of them putting out some incentives for getting younger people to get vaccinated. And then the provinces are, of course, putting out all sorts of ideas, and from lotteries to, gaming licenses, I think for hunting licenses, and all sorts of things to try and incentivize that community. And Nunavut is doing something different to incentivize their youth. So I do think it is a matter of empowering trusted voices and community leadership, as well as private and public sector collaboration as well. But really, there's no one size fits all. It's possible that, something like travel, international travel, can incentivize people to get vaccinated as well, because not necessarily because you're coming back into Canada, but because other countries are going to be looking at vaccinations as one way of reducing some of their quarantine measures. And so there's lots of things that might be provide an advantage to young people, as we move forwards into our sort of recovery pathways. And so I think that there's no simple answer, but that is the population. And on top of that are actually more marginalized populations within that age category as well.
Thank you, Dr. Tam. Next question. Thank you, operator.
La prochaine question est de Aimé Lemieux, Radio-Canada. La parole est à vous.
Oui, bonjour. Ma question est pour le docteur Liu. On comprend aujourd'hui, parce que vous nous dites que la pandémie est sous contrôle à l'échelle nationale. On ressent très peu de nouvelles contaminations chaque jour et parallèlement, la vaccination aussi va bon train au pays. Mais ce qu'on voit à l'international, c'est qu'il y a des nouvelles flambées des cas dans certains pays. On peut penser au Japon, à l'Indonésie. Il y a des variants, évidemment, qui multiplient. Est-ce que vous avez des inquiétudes, des craintes particulières au Canada à l'heure actuelle?
Oui, mais merci pour la question. C'est Dr. New. Oui, la situation au Canada, c'est pour l'instant, ça va très bien avec les tendances dans les bonnes directions pour la couverture vaccinale, aussi pour le nombre de cas de contamination, les cas dans les hôpitaux et aussi dans les unités de soins intensifs. Mais oui, comme vous avez constaté, on regarde, on suit étroitement la situation dans les autres pays, parce qu'on apprend toujours des expériences dans les autres pays. On voit même en Europe, en Israël, les autres pays avec leur expérience, même avec la vaccination, aussi avec leur assouplissement des mesures de santé publique. On voit qu'il faut faire vraiment, comme dire, avec beaucoup de prudence si on commence à assouplir les mesures de santé publique en même temps qu'on continue avec les programmes de vaccination. Donc, je pense qu'ici au Canada, il ne faut pas, comme dire, lâcher, il ne faut pas être, comme dire, trop, comme dire, c'est quoi le mot, même en anglais, trop confiant que oui, c'est fini avec la pandémie. Non, il faut toujours continuer avec la vaccination, parce que la couverture vaccinale, c'est vraiment un enjeu important, parce que maintenant, on va vraiment atteindre au moins, je pense, un niveau peut-être de 80% de la couverture vaccinale avec les 2 doses, parce que si on a encore comme des communautés ou des sous-populations pas complètement vaccinés, ça peut être peut-être une étincelle pour les éclosions peut-être à l'avenir, peut-être en automne, quand tout le monde commence à rentrer à l'intérieur. Donc, c'est quelque chose à suivre, mais aussi avec l'assouplissement des mesures de santé publique. On va regarder aussi avec nos homologues des provinces et territoires qu'est-ce qui va se passer avec les événements, les rassemblements à l'extérieur, aussi à l'intérieur, c'est quoi l'expérience, et c'est sûr que si c'est nécessaire, on peut toujours ajuster nos mesures de santé publique à part de continuer avec nos programmes de vaccination. Merci.
And move forward with our vaccination program. Thank you.
Oui, et sur le variant Lambda, le nouveau variant qui a été recensé au Pérou, qu'est-ce qu'on sait là-dessus, sur sa présence au Canada, et quel genre de surveillance vous faites sur ce volet-là?
On that variant?
Well, premièrement, merci pour la question. La première chose, que c'est avec les variants, on attend toujours qu'avec les mutations des virus, on entend toujours qu'il y a des autres variants qui vont, comme dit, émerger. Donc, le variant Lambda, c'est la nouvelle, comme dit, souche d'un variant préoccupant. On regarde à travers les pays, les laboratoires aussi avec les autorités de santé publique sont toujours en train de suivre étroitement la situation. À l'échelle nationale, on a un petit nombre de cas signalés. Peut-être, je pense que c'est 11 jusqu'à peut-être hier, mais on sait peut-être qu'il y a aussi un délai avec les rapports, que peut-être actuellement, il y a plus de cas signalés dans les provinces et territoires, mais c'est quelque chose à suivre parce que, comme j'avais répondu à la dernière question, c'est comme ça, il faut toujours continuer à être prudent parce que avec les variants préoccupants, peut-être plus transmissible aussi, peut-être avec les conséquences plus graves. C'est pas le moment d'être, comme dire, trop confiant avec l'assouplissement des mesures de santé publique. Et il faut toujours répéter que c'est très important pour tous les Canadiens et Canadiennes de se faire vacciner, pas seulement avec une première dose, mais aussi avec une deuxième dose.
Merci, Dr. New. Prochaine question.
Thank you, Dr. New. Next question, please.
The next question is from Glenn McGregor from CTV News. Please go ahead.
Thank you. A question for Dr. Tam. A lot of speculation right now that we could be into a federal election campaign in the very near future, possibly as early as August. Election campaigns require lots of travel. We bring a lot of people into contact with each other who wouldn't be doing so otherwise, including big events and rallies. Is it safe to do this right now? And if so, do you think there's special measures that need to be put in place to run an election campaign? Or is there a target of vaccination percentages that should be achieved before we go into a federal election?
Thanks for that question. I have no say on the timing of any elections. That they have to follow. Anyone who's doing any campaigns or gatherings have to follow the local public health rules wherever they are doing that. Right now, as you know, provinces have their opening stages. And in Ontario, maybe only allow the gathering of X number of people indoors and X number of people outdoors, and you have to respect those rules. And they are there given their local circumstances and epidemiology to reduce risks. So whatever people are doing on their for election campaigns, that's one thing that they have to remember. We do, obviously, there are guidance provided to how you reduce your risk in terms of wearing masks. If you even if you're vaccinated and you don't know who else is around, that is whether the people that you're encountering are vaccinated or not, then the most prudent precautionary thing to do is wear a mask and make sure that there's some distancing measures and other measures that Canadians now know very well what they might be to reduce their individual risks as well. But I think I encourage all political campaigners and their teams to follow those rules and get vaccinated.
Yeah, I want to ask you again about the border. You've had advice, federal government's had advice since May that the border should be opened up much more than it even is now to people who are singly vaccinated or double vaccinated. And the tourism industry today is calling for the government to introduce some kind of guidelines on how this is going to happen, to tell industry how the reopening will occur. Have you been giving any advice to the federal government on reopening the border? And if so, what is it? And when do you think that can start to happen safely?
Well, I think the first stage has begun. So I think that's good news. And I think, obviously, we're looking at, as we give our advice, looking at the data that is even produced at this early stage as to, well, what is the test positive rate and what are we finding in the actual travelers coming in right now in this very initial precautionary phase. And then that might then help us adjust the next phases moving forwards in terms of what's the testing regime that's appropriate for vaccinated travelers, for example. And our other advice, of course, looks at the vaccination coverage, which is going, I think, pretty well at the moment. We're not, not everyone's had the full vaccine coverage with 2 doses for the vaccines that we have at the moment, but that is going pretty well. So I provide advice on how that trajectory is going, and that's fine. I look at the variants of concern and see if they are being covered by our vaccine. And so far, I think the majority of them are pretty well covered, and we have good protection. And the epidemiology is settling down in Canada, or a great trajectory. Our hospitals are not overrun, although in some places ICUs and haven't quite recovered. And so all those dimensions, indicators are being provided to our decision makers. And of course, there's a massive multi-departmental effort in operationalizing these things. So it's not just one minister, but many ministers, many different departments working together. And ultimately, I think I will, of course, leave it to the Prime Minister to communicate what the next steps might be.
Thank you. Next question. Prochaine question.
The next question is from David Thurton from CBC News. Please go ahead.
Hi, bonjour. This question is about non-essential travel. Dr. Tam, there's a lot of Canadians who are planning on maybe traveling within Canada, interprovincially to the territory. They have 1 dose, 2 doses. What is your advice to Canadians who, want to do vacation travel or non-essential travel? What should they be thinking about if they decide to do that?
Great. Yes, Canada, as I said, have a varied landscape in terms of what's happening locally as well as provincially. And so there are different regions with different risks. Even within Ontario, for example, there are a couple of areas where they still have heightened epidemiologic activity. And so I think before any travel, of course, check to see what's happening in the place that you're traveling to. And this is a broken record, get fully vaccinated. That's the best protection before you travel. 1 dose does protect the individual quite well from severe outcomes, but 2 doses provide much better overall coverage for symptomatic illness and certainly to reduce transmission risks. And different jurisdictions do have different rules. So before you fly into the Atlantic provinces, please do check, because they may not be the same as Ontario, Quebec, or indeed the territories, given their own set of circumstances and their health system capacity. So always do that. And then the other things, of course, don't travel if you're ill. Absolutely have to take a mask, because if you're going to go on communal transport, public transportation, airplanes, etc., you're going to have to abide by those rules. Where those higher risk settings, for examples, public transportation, take the appropriate personal precautions. And then we've suggested some personal risk reduction tools that people can sort of look up, and what might you expect to do in terms of life after vaccination? Who are you meeting? If it's your relatives, have they been vaccinated? Are they at high risk? So that kind of personal situation and risk assessment should be done as well. But many provinces, as you've seen, have already sort of reopened and relaxed some of their own internal recommendations pertaining to domestic travel.
So is it fair to say, Dr. Tam, that you are no longer advising against non-essential travel? I just ask this because, I think that's important to just kind of underscore here, because in the winter, in the previous month, you've been cautioning against non-essential travel, both internationally, but even interprovincially and interterritorially and that kind of thing. So is it fair to say, once you follow the precautions and once you take all the measures that you just outlined in your previous question, you're no longer advising against non-essential travel? It's okay to undertake that kind of movement?
That's a great question. Internationally, we still advise against non-essential travel, given that we are actually one of the fortunate countries that have had a really great vaccine supply, for instance, and not every country is like that. The Delta variant, by the way, is accelerating in many. So that advice still pertains to international travel. For domestic travel, again, observe the provincial rules, because some of them have still got some of those advice. But I do think that if you're a fully vaccinated individual, you can take that risk assessment and decide what you need, what you can tolerate in terms of risk and how to protect yourself. So if you want to go and visit your family member and you've checked out all those contexts and you can do it safely, I do think that summer is a great time to meet people, even on a non-essential basis, outdoors in particular.
Thank you, Dr. Tam. Next question. Prochaine question.
La prochaine question est de Raymond Fillon, TVA. La parole est à vous.
Merci. Bonjour, question pour Dr. New. Pour revenir au variant Lambda, vous ne semblez pas préoccupé, docteur, par ce variant-là. Est-ce exact et pourquoi?
Pour l'instant, c'est une variante, je pense qu'on a dit à l'échelle mondiale, une variante d'intérêt. On ne sait pas exactement est-ce que c'est vraiment beaucoup plus important par conséquence pour être plus transmissible, aussi peut-être aussi avec les conséquences plus graves. Donc, c'est quelque chose à suivre. On suit aussi qu'est-ce qui se passe dans les autres pays, mais je pense que n'importe quel variant ici au Canada, on trouve les mêmes mesures de santé publique sont toujours en vigueur. C'est la souche originale ou un variant préoccupant. C'est toujours la même chose. Le port de masque, la distanciation physique, toutes les bonnes mesures de santé publique à l'échelle de la communauté, mais aussi à l'échelle individuelle. C'est des mesures de protection, des couches de protection, je peux dire, à part aussi de la vaccination. Donc, c'est toujours, on répète toujours les deux volets très importants. C'est continuer avec la vaccination pour avoir une bonne couverture vaccinale à travers les pays, dans chaque province et territoire, et aussi continuer avec les mesures de protection individuelle au fur et à mesure, peut-être selon le seuil de tolérance au risque, mais aussi avec les situations épidémiologiques dans la région où vous habitez et toujours suivre les conseils des autorités sanitaires dans votre région. Donc, oui, c'est quelque chose, on continue à surveiller, mais pour l'instant, et c'est l'été, on ne peut pas être toujours, comme on dit, inquiète pour tout. Il faut, comme on dit, trouver un équilibre. Oui, il faut être toujours conscient et regarder qu'est-ce qui se passe, mais il faut aussi vivre un peu, je pense que ça, c'est mon avis. Trouver un bon équilibre, pas être trop comme des pessimistes, mais aussi trouver les choses pour avoir un peu d'optimisme pour l'été, mais toujours garder aussi un peu de, comment dire, prudence.
Well, of course,
et vous parlez aussi de 11 cas au Canada, 11 cas connus. Avez-vous le breakdown, excusez l'expression, par province?
Non, pas vraiment. Et je pense qu'aussi, moi, j'ai appris qu'au Québec, peut-être que les autorités, même au Québec, plus que 11 les cas signalés. Donc, il y a toujours un délai. On est en train de toujours travailler étroitement avec nos homologues des provinces et territoires pour avoir, comment dire, une précision pour les cas de Lambda. Mais je pense qu'au fur et à mesure, on va toujours essayer de mettre nos données ici à l'échelle nationale à date. Mais pour l'instant, on dit c'est environ 11. Et je ne sais pas personnellement, comment dire, par province, mais on pourra toujours peut-être faire un suivi après le point de presse.
Follow-up after the press conference.
Merci, Dr. New. Prochaine question. Next question.
The next question is from Charlie Pinkerton from iPolitics. Please go ahead.
Hi, everyone. Good morning. My questions are probably best for Dr. New or Dr. Tam. The UK will soon be opening up with very few restrictions, which is something the WHO has warned against recently. In the UK particularly, they're seeing a surge in cases, but no longer deaths. I'm wondering if you can talk about how you're monitoring that unique situation, as well as if there is a target here in Canada with our now impressive vaccination campaign, that should there be a rise in cases, what ratio to deaths or ratio to hospitalizations would it take for COVID to be considered something or a virus that we're capable of living with minimal restrictions as long as a certain percentage of the population is vaccinated?
Yes, maybe I'll start. I think we've been monitoring quite closely what's happened globally, but particularly in countries that are highly vaccinated. So that's of great interest, of which for which UK is one. But not every country is the same. We don't have exactly the same vaccines, although we all know that all of the vaccines being used, both in the UK and Canada so far, has good protection against severe illness. And so I think, given the UK situation, I am really particularly interested in whether the cases are now delinked from severity indicators. So if you're only getting cases, but no hospitalizations or no deaths, then that is an important difference of a vaccinated country going forward. So I'm definitely following that. So at the moment, we do know that the Delta variant can cause more severe outcomes. But whether it gains ground in a vaccinated population, I think we're just beginning some of the provincial reopenings. There's always a possibility that the cases will rise again, and then we will have to monitor what the impact is against hospitalizations and deaths. So I'm really hoping that this dissociation between cases and the severity indicators will be something of a reality. But the other thing to monitor again is that it's the variants that are most concerning to a vaccinated country are the ones that escape vaccine protection. So we do have to constantly be vigilant against that. But there is no, magic ratio or indicator between the two. But I think what we should look at is just monitor the trend in the divergence of those indicators and see if that's a positive sign that we can look forward to. Having said that, of course, we also want to continue to monitor what happens to people who've had mild illnesses and even asymptomatic illnesses, and whether they have any sort of longer term impact, or the so-called post-COVID condition are some of the other factors that goes into some of our policy recommendations as well. But I think if the UK observes that, I'm hoping that we will also see that great protection against severe outcomes as well.
It's Dr. New. I just would add to, I think that the WHO, as you said, internationally made the great point that they're warning countries not to sort of let go or loosen their public health measures too quickly, because obviously everyone's worried about, in certain countries that fourth wave. So certainly we're examining what's happening in the UK. But as Dr. Tam mentioned, here in Canada, we're also starting to shift, looking at the great impact that the vaccines have had, where obviously they've reduced severe illness and deaths. Those are the important indicators. And looking at our healthcare system, we certainly don't want to return back to those tough times in certain provinces where the healthcare system was really close to the breaking point, with ICUs being overloaded, healthcare workers exhausted and really in bad shape. So with that, I think we hope to get to place, and I think we're getting there, that with the decrease in number of cases, I don't think we're too worried about the cases per se, but really sort of the severity of the cases, and seeing, as Dr. said, if they're delinked in terms of cases versus severe outcomes, and also getting to the point that the public health authorities feel comfortable they can do their tried and true, sort of public health approach of with test, trace, and isolate, the contact tracing and so on, that in many parts of the country really they were unable to do with so many cases happening during sort of the winter season. So I think it's looking good, but we'll continue to monitor the situation and adjust as necessary. And as Dr. Tam said, there's no magic number at this point. I think certainly the wild card, I would say, is the emergence of the variants, and we're certainly always watching to see if there's what we call vaccine escape, or what the impact might be of the variants on overall vaccine effectiveness. Thank you.
Oh, lovely. Sorry, I was waiting for my little prompt for my follow-up. Dr. Tam, something you said there about being very interested in this particular example. Looking ahead, watching that example, how could what is learned from what happened in the UK then help Canada? Because much like has been the case throughout the pandemic, we have been behind some countries, ahead of other countries, being able to learn from each other throughout. So is there ways then that, whether it be by changing federal advice or, allowing travel restrictions to ease faster, that could be influenced by what is observed from the UK, or how could that be applied, I guess is what I'm asking.
Well, I think if we do see a delinking of case to severity, then, provinces and territories might change some of the policy stance in terms of relaxation or not going backwards. So the other thing is, how fast you put the brakes on is a difficult question. And we've always said early, like before you see the deaths come, put the brakes on. And in the post-vaccine era, that kind of risk assessment may have to shift. But the other warning, I think, is that we have a heterogeneous landscape in terms of vaccine coverage. And I do think that even if at the national level, we see good signs in terms of ICU admissions or hospitalizations or indeed deaths, I do think we're at risk in the undervaccinated pockets and specific populations to see an increasing disparity, if you like, in those outcomes. And that's what we don't want to see. And that's why more efforts should be done in getting some of the remaining groups vaccinated. Again, I look to somewhere like the Yukon and their experience, and some of the people experiencing more severe outcomes would be in, for example, emergency shelters, or other health equity deserving populations who are distrustful of the health system. So I think instead of blanket approaches, we should now be switching to a much more targeted, nuanced approach to how we manage this pandemic. And there may, again, be no one-size-fits-all with the whole of Canada in terms of policy. So I do think that, again, it would then boil down to sort of local level intelligence as to what's happening in the community. But it might mean less, as you've been pointing out, maybe less blanket sort of travel advisory approaches if we can reach that good spot of having our population very well vaccinated.
Merci, Dr. Tam. Next question will be the last. La prochaine question sera la dernière.
The next question is from Leslie Young from Global News. Please go ahead.
Good morning. I wanted to ask about the Olympics. Another state of emergency has been declared covering Tokyo because of rising infections. And with Canadian athletes on their way to the Olympics, what involvement has Public Health or Health Canada had with the Canadian Olympic Committee to ensure the safety of athletes traveling to Japan?
Yes, maybe I'll start and see if Dr. New wants to add anything. Obviously, there is collaboration and public health advice essentially being provided. And it's not just us, it's together with the provinces and territories. Because one of the key efforts is to get the athletes vaccinated before they travel. And so as far as I know, that's been going really well. And so that we expect then the Canadian delegation to have that very good layer of protection. But nothing is completely risk-free, so there are protocols and safety protocols at play within the Olympic fence, if you like, for which the athletes will have to follow. The protocols are there in Japan for testing, as well as for bubbling, and following all the rules to minimize any potential acquisition of infection or indeed passing it on. So I do think some of those protocols are in place, but we do still have to, I think, watch the epidemiologic situation from day to day and have the flexibility to adapt as needed.
Yeah, Dr. New, there's not much more to add, just as Dr. Tam said, that certainly in our discussions with the Canadian Olympic Committee in terms of the delegation going to Japan, everyone understood that it's not a zero-risk scenario, that we can mitigate the risk as much as possible by various layers of protection, and obviously vaccination is very important. So all of the athletes, I think, have been or were offered a vaccination to be fully vaccinated before they go over for their events. And certainly we also expect them to follow all of the rules and protocols that local public health authorities in Japan have put in place in terms of, quote, the Olympic bubble. So I think everyone is going in, as they say, with their eyes wide open, recognizing the risks involved. And certainly the epidemiologic situation in the general population, what's happening generally in Japan, obviously, I think is very concerning for the authorities there, obviously, with what's been declared with the state of emergency and so on. So I think it's something everyone's keeping an eye on. But for the present time, at least from a public health sort of risk mitigation approach, everything that needs to be done has been done from a Canadian perspective with respect to our delegation going to Japan. Thanks.
Thank you. I also wanted to ask about first doses. You touched on young people, but more broadly speaking, who are some of the remaining groups and under-vaccinated populations, and how do you plan to reach them?
Yes, so reaching the unvaccinated is every level of government and private, as I said, private, public collaboration needs to be involved. But apart from, for the younger population, we know that they were offered vaccine the sort of most recently. So we do have to take that into account. But now that vaccine's been around for some time, we are getting a bit concerned that that group isn't, offering their arm, as it were. So and it's not just the age factor. What I'm hearing and what we're seeing on the ground are still disparities in terms of vaccine coverage. For example, certain indigenous populations overall, for example, First Nations communities are have done really well with their own leadership, fueling that response. But they're actually very different. There are specific communities that have low vaccine coverage, and that is work with local Indigenous leaders and Indigenous Services Canada to have culturally appropriate responses that are leverage their own leadership. Black Canadians are stepping up in terms of leadership. Personal support workers. So in a long-term care setting, the residents might be well vaccinated, but we need to actually support some of the workers in getting vaccinated and increasing trust, answering their questions, etc. So a lot of work has been done. Shelters, we're worried about some of the people experiencing homelessness. So another group that we need to target. So some of what we've been doing is really just trying to support community groups, and so that they are the trusted voices and by the community and the on the ground NGOs. Through our various streams of funding. And so the Vaccine Community Innovation Challenge is one of them, and the Immunization Partnership Fund, and you can read about some of the really amazing projects in different languages and using different cultural approaches, behavioral insights, and trust fundamentally to reach those populations. But that's definitely pockets of under vaccination in those groups. I think in incentivizing young people, I have a firm, massive belief in our younger adults. We shouldn't sort of blame them. We should make sure they have access. We should make sure they know all the benefits of getting vaccinated, and not the least of which is be able to continue their work and their social connections. We have been trying to sort of leverage social media influencers and other private sector that are trying different methods to incentivize those groups. And in the end, I think some things like in the fall, I'm concerned about the fall because people will be going inside. There's other respiratory viruses, so it's going to be a more difficult environment. But if you want to go back to university, if you want to, get back to some of those really important interactions, then getting vaccinated is really, really key. And I'm hoping that all of those reasons will help that group to get vaccinated.
Yeah, it's Dr. Maybe just add to what Dr. Tam said. Certainly, for certain vulnerable populations, like Indigenous peoples, there are other barriers in terms of, be it trust, accessibility, and certainly we need to work at that. But I think the point that's been raised about, quote, younger people in general, I agree with Dr. Tam. It's not about blaming and shaming. It's about finding ways to hit them where they are in terms of what they're looking for. And as with other communities, I think trusted leaders are recognizing what are the social groups or settings in which these, let's say, certain young people are very engaged in, and hopefully having trusted voices in that community. For example, I'll just pick an example. My own kids, as gamers, right? There's a whole gaming community. Maybe reaching out with even further efforts in terms of that community and trusted voices and leaders, and maybe sort of the key players in that particular sector. That's one way to reach. I think those various segments of the demographics, the younger population, and so on, that we hope to give the right messages so that they understand and appreciate why it's important to get vaccinated, not just for themselves, but also for their family and friends. Thank you.
today's technical briefing. C'est ce qui met fin au briefage technique d'aujourd'hui. Si vous avez des questions additionnelles, veuillez communiquer avec le Bureau des relations médias de l'Agence de la santé publique du Canada. If you have additional questions, please reach out to the Media Relations at the Public Health Agency of Canada. Merci beaucoup et bonne fin de journée.